Hi, everybody, and welcome. I'm Jeannie Whiting, Executive Director and co-founder of the Desmoid Tumor Research Foundation. Whether you are newly diagnosed and just discovered the foundation, or whether you've been dealing with a tumor of your own or someone else that you're close to for the longer term, we hope that we're always a source of support and answers for you. That's such an important part of our mission. I myself am a Desmoid patient. 16 years ago, I co-founded the foundation, and it's just so important to have answers, and we're so excited about the program tonight for the many answers and ideas that it's going to give us. So I'll turn the time now over to Lynn Hernandez, who is our Director of Operations, to introduce the program.
Hi, everyone. Thank you, Jeannie. I'd like to welcome you to the DTRF's very first Dealing with Desmoids webinar. This is hosted by Ashley Williams. This webinar series aims to bring coping strategies to the desmoid tumor patient community. Thank you so much for joining us this evening. I'd like to introduce you to Ashley Williams, our presenter. She is a licensed clinical social worker and trauma counselor, and she lives in South Florida. In 2015, she was diagnosed with a desmoid tumor in her left leg. Since then, she has become passionate about helping patients heal from the trauma of their diagnosis and treatment. Her focus is on those with desmoids, cancer, chronic illness, and other rare diseases. Having undergone multiple rounds of treatment herself, Ashley believes in a holistic and mind and body approach to healing. She continues to help individuals from these communities work through their trauma in her counseling practice. So before we get started, I have a few instructions for our session together. We welcome any questions via the Q&A, which you'll see at the bottom of the screen. If you have a question for Ashley, please share it there, and she will try to get to it at the end of the presentation. Also, you'll see that there is a chat function, and it is open for your use to communicate with the community. Please note that the chat will not be monitored by us. So if you have a question, again, make sure you put it in the Q&A. Now I'll hand things over to Ashley.
Thank you so much, Lynn and Jeannie. I am so excited and so honored. I'm actually a little bit emotional being here tonight because as Lynn shared, I am a desmoid patient myself. And so being able to combine my professional experience with my personal experience, this is just an opportunity that I feel really honored to have. And I know from my personal experience, but also from my clinical practice, that mental health, especially after diagnosis and treatment, is something that is often left unaddressed and undiscussed. And so today we're really going to be talking about trauma. We're going to be learning about what trauma is and how to develop resilience to the trauma that we experience that comes with our diagnosis and treatment. So I am going to share my screen quickly. All right, so we are going to be talking about trauma resilience today. I do want to note that while I am a desmoid patient myself, I am not a doctor. And so today is really intended to give information and education and kind of a general overview of what is trauma and how to develop resilience to trauma. During today's session, I'm not going to be giving any type of medical advice. I'm not going to be talking to you about specific treatment modalities or anything like that for our tumors. And even from a mental health perspective, yes, I am a licensed clinical social worker, so I'm a mental health professional, but I am not your mental health professional. And so this information is intended to bring some awareness and some insight into what our experience is like, but trauma and our experience with trauma and our recovery from trauma is a highly individualized experience. And so it's something that should be discussed between you and your mental health professional. If you have any questions that come up after today's session, I will be happy to answer what I can. You can ask in the Q&A box like Lynn shared, or if there's anything that goes left unanswered, feel free to reach out to me. My email is listed here at ashleywlcsw@gmail.com. So as Lynn said, yes, I am a licensed clinical social worker. I worked for about 10 years in foster care, and in the foster care realm, I dealt with kids who had experienced trauma, and that was kind of my niche. I hate to say it, but I was fascinated by trauma and its effects on the body and how do we recover and heal from that. And so when I received my diagnosis, it was very presumptuous of me to think this, but my initial thought was, I'm a trauma researcher. I'm a trauma therapist. Like, I've got this. I'm built for trauma. I know what to do. And I hope some of you are laughing at me because I'm laughing at myself looking back now, that nobody is built for trauma, no matter how much we know about it, no matter how much we think we know what to do whenever we experience trauma. Nobody's built for it. None of us are prepared for it. And it is a difficult process to experience and also to overcome and heal from. I have experience specific to the Desmoid journey. And so in 2015, I was diagnosed with a desmoid in my left leg. And since then, I've gone through 3 different treatments. I've gone through chemos, I've gone through cryoablation. And so being in the medical environment and having medical trauma is something that I'm well versed in, both personally and professionally. Now, before we start on really talking about what trauma is and how it impacts us and its effects on our body and how do we develop resilience to it, I do want to highlight the fact that trauma is a very heavy topic. And today we're going to be talking specifically about the medical trauma that's a part of the Desmoid journey. But for many of us, we have likely experienced trauma in different areas of our life, both medically, but also not medically. And so if at any point during our session today, if the content feels a bit overwhelming or you feel like you're struggling, I want to offer you one strategy to be able to employ, and also want to give you permission that if you need to take a step back from the content, feel free. It's being recorded and it's something that you would be able to have access to at a later time. But one of the most effective coping strategies that we can use when dealing with trauma is this thing called box breathing. We're going to go deeper in a little bit as to why it's important and how it helps us. But right now, it's just important to note that this is a strategy that's used by Navy SEALs, Marines, Green Berets, people who are in really high stakes, high stress situations who have to remain calm. And so this is a technique that has been used since ancient times to be able to help calm our nervous system, which is one of the most important pieces in developing resilience from trauma. And so box breathing, it's called box breathing because it's as if we're tracing the sides of a box. It's inhaling in for 4 seconds through your nose, holding that inhale, holding that breath in your lungs for 4 seconds, exhaling for 4 seconds out of your mouth, and then holding that breath, holding your deflated lungs for 4 seconds before breathing in again. So inhale, hold, exhale, hold. If you do that cycle, that box breath 3, 4, 5 times, it can calm our nervous system down anytime we're feeling heightened, anytime we're feeling turned on, whether it's any stressor in our life, but particularly today as we go through this content. If at any point you feel overwhelmed, I encourage you to come back to this box breathing technique to kind of help calm the nervous system. And we're going to talk now about why that's important and why that's a strategy that's helpful for us. When we talk about trauma, we're talking about a whole body experience. The long understood definition of trauma has been that it's like a bad event that happens to us. We tend to think about trauma in regards to abuse or natural disaster or veterans who are returning from war. But in reality, trauma is, yes, it's an external event that happens to us that causes us to feel unsafe, or we feel threatened, our lives feel threatened, or our well-being feels threatened. And that event causes an internal response. You'll see here that trauma is now defined as what happens inside of us as a result of what happens to us. It's an experience and it's not an event. And so that experience of, okay, there's some sort of threat to my well-being and it's causing an internal reaction inside of me. It's causing me to feel an overwhelming sense of terror, horror, hopelessness, not knowing what to do, not knowing how I'm going to escape this. That feeling causes some sort of physiological response. And those physiological responses tend to be things like increased heart rate, rapid breathing, trembling or shaking, dizziness. And so trauma affects not only our brains or our experiences, but it's something that we feel throughout our whole body. And it's something that affects our physiology and our biology as well. So our body's response to trauma is really important to understand, to know. Once we've experienced it, how do we combat it? How do we develop resilience to it? Now, like we said, an external threat happens that kind of triggers all of these internal sensations and this internal reaction. What happens is whenever we identify a threat, like a diagnosis, for example, the part of our brain that activates is a part called the amygdala. And this is our fight or flight center of the brain. And so I think we've all been in situations before where we know that there's impending danger of some sort and we go into that fight or flight mode. Now, if we're in a situation where we know that we can't necessarily fight and we can't necessarily flee, then the reaction is sometimes that we freeze. And so some of us may have experienced that freezing response. Whenever that amygdala is triggered because there's a threat in our environment, there are certain chemicals and hormones that are released into our bloodstream. So adrenaline, noradrenaline, cortisol, and these are the things that cause those physiological reactions that we talked about. So rapid heart rate, heavy breathing, sweaty palms, trembling and shaking. And those chemicals and those hormones are released into our bloodstream until the threat is removed. And I think that's a really significant piece for the Desmoid experience, because all of that is happening in our body. We're hyper aware, our alarm system is activated until the threat is removed. Once a threat is removed, then there's other chemicals released in the body that help us to return to balance or return to normal. But what happens if a threat is never removed? What happens if we are constantly living in a state of feeling like our well-being is being threatened on a regular basis by things that are all around us or by something that's inside of us? And that's what we're going to be talking about today, is just the reality of our experience with trauma and understanding that if the threat is never removed, then the biological processes of bringing our body back to normal don't happen. And so how do we jumpstart that for ourselves, and how do we manually make that happen so our body can go back to a place of feeling calm and feeling in a place of balance? Now, this is our body's response to trauma, but it's important to also look at the brain's response to trauma. On the left-hand side, you'll see it says a normal brain, but it's a brain that hasn't experienced prolonged trauma. And on the right side, you'll see a brain that has experienced prolonged trauma. Now, our brains, they work on a use it or lose it principle. And so the parts of the brain that are used are the parts of the brain that are going to grow. And the parts of the brain that aren't used are either going to not grow or maybe even potentially atrophy. And so what this scan is showing us is that when that amygdala is activated, when that fight or flight center of the brain is activated, that's the part that's going to grow. And so that's the part of our brain that is going to kind of trump the way that the rest of our brain operates. And we're going to start filtering our experiences through that center. And so we're going to start filtering experiences that may not even be a threat through that fight, flight, or freeze center of the brain. And you'll notice on the brain that's experienced prolonged trauma that there's actually a portion of the brain that looks very different in that scan than on the other scan. It shows that the amygdala has actually grown. Our brain has actually changed. New pathways have been formed based off of that experience of being exposed to prolonged trauma. Finally, I know we're going into a little bit of a science lesson, but I think it's such an important foundation to build for how trauma affects us, and understanding how it affects us, then that gives us a framework or a baseline to be able to know how to combat the trauma that we've experienced. But trauma affects our nervous system in a very significant way. And so whenever that amygdala, that fight, flight, or freeze center of the brain is activated, it's telling the entire body that there's a threat to our well-being. There's a nerve called the vagus nerve that runs from our brain to the organs in our body. It runs to our stomach, it runs to our heart. It controls all of our like the functions that we don't think about: digestion, breathing, all of those things. And so whenever we experience trauma, that vagus nerve is what communicates to our body, okay, there's a threat here. And that's what causes all of the physiological reactions that we feel. That's what causes our stomach being in knots. That's what causes our heart pounding. That's what causes body temperature fluctuation. So we might start sweating, or we might get chills whenever we're experiencing trauma. Now, if we're exposed to prolonged trauma, if we're experiencing something that's threatening our well-being for a significant amount of time, the vagus nerve will actually like short circuit, and it will concede to the amygdala, and it will say, okay, you take over because there's a threat going on. I'm just going to bow out. I'm going to disappear. And so what happens whenever that takes place, when our vagus nerve kind of shuts down, it means that, one, our brains aren't necessarily in touch with our body. Those intuitive or those visceral reactions, that understanding of how our body's feeling, we don't necessarily have that sense of awareness anymore, because the sensations within our body that we experience when we've experienced trauma can be so overwhelming that it's a protective mechanism sometimes for that nerve to shut down, so that we don't necessarily feel all of the visceral and body responses to what we're going through. Now, this nerve, the vagus nerve, is also responsible for our rest mechanism. And so when the amygdala is turned on, that fight, flight, or freeze center is turned on, once the threat is removed, it's the vagus nerve that communicates to our body, okay, threat's over, like now it's time to rest. So if that disconnects or that kind of short circuits, then our body is never signaled the fact that, okay, the threat's removed and it's time to rest. And so even though we're trying to sleep or we're trying to rest, we may continue to feel exhausted all the time, fatigued all the time, have difficulty sleeping, have really vivid dreams. And so when trauma happens, this is some of the biology and some of the things that are going on in our brain and our body to facilitate what we feel and that overall experience that we talk about trauma being. Now, we're not going to go through all of these, but these are a number of trauma responses. When we've experienced something traumatic, it affects us emotionally, behaviorally, physically. It also affects our thoughts. It kind of affects everything. I mean, it is truly a whole body experience. And I think that we've all felt that at some point in time. Emotionally, we might feel things like losing hope for the future, being easily agitated, unable to trust others, feeling rejected. Behaviorally, we might see that we're more easily angered and we have outbursts, or we isolate more when we used to really like to be around people, or we might be trying to numb like some of the sensations that are going on in our body by drinking or using drugs or engaging in some sort of risky behavior. Physically, we will also have symptoms, headaches, poor digestion, body shakes, sweating. These are all things that happen whenever we experience trauma because it's something that affects our entire body. Now, we experience these things when we're going through the initial trauma. So for the sake of what we're talking about today, we experience these things upon diagnosis, but we can also experience these things throughout our journey. And even if your treatment of your desmoid has come to an end and you haven't gone through treatment for a significant period of time, triggers still come up on a regular basis for all of us who have experienced some sort of trauma. Now, the best way for me to describe a trauma trigger is through this example. Let's say that I have a bunch of trails behind where I live. And so let's say that I'm walking one of those trails one day. I walk it pretty much every day. And all of a sudden in front of me in the path, I see a cobra. I mean, cobras don't live here, and so that would be frightening, but I see a cobra that has reared up. It's hissing at me. It is poised as if it is ready for attack. My body is registering, this is a threat. That amygdala is being activated. I'm going into that fight, flight, or freeze mode. And I am either going to fight that snake, or if it's me, I'm gonna flee and I'm gonna run away from that snake and try to get to a place where I'm safe. Now, say a couple of days passed, my nervous system has finally calmed down, the threat has been removed, and I decide, you know what, Ashley, you've been on this trail a million times before. You have only seen a cobra one time. What is the likelihood that that's going to happen again? And so I muster up the courage and I decide, you know what, I'm going to go down that path again, and it's going to be okay. Now, if I go down that path again, the reality is that I'm going to be hyper aware. I'm going to be hyper vigilant of my surroundings because I've learned that this is a dangerous path. And let's say I'm walking down that path and out of the corner of my eye, I see a long brown squiggly thing. My body is going to immediately tell me, Ashley, this is a threat. I'm going to go into fight, flight, or freeze mode, and I'm going to hightail it out of there. Now, it doesn't matter that that long brown squiggly thing out of the corner of my eye was actually a stick. My brain is going to recognize that this is a place where there was a threat before that looks similar to a threat. And so it's going to activate that same alarm system. We experience those types of triggers on a regular basis based off of what we've been through a Desmoid diagnosis, treatment, and beyond. There are so many things within our experience, and some that I'm sure many of you can identify, that can trigger us and cause us to feel as though we're back in that same place that we were whenever we were experiencing something traumatic. And it may feel weird, like this feels really out of place. Why am I reacting this way? But there's something that triggered us and reminded us that, you know what, you've experienced the trauma before and something about this situation feels unsafe or feels reminiscent. Now, I've identified 4 things on the screen for you that are common triggers, but they are not all the triggers. So one common trauma trigger is sensory triggers. For me, I had chemo through a port, and every time my port was accessed, they would clean it with heparin. In between the 2 chemos I was receiving, they would clean it with heparin. And then after chemo, they would clean it with heparin. And if you have had heparin through a port before, you know that it probably to you too tastes like having hand sanitizer in your mouth. Like that taste is very, very strong. So for me, anytime I smell hand sanitizer, anytime I smell a cleaning product with rubbing alcohol in it, I immediately, my heart rate goes up. I've been known to cry in the presence of hand sanitizer, but it's that sensory experience of, okay, this is the smell that told me like I was about to get sick, I was about to get chemo. And so this smell now triggers for me that same fight, flight, or freeze mode. Pressures, individual pressures can also be a trigger for us. Things like financial pressure, receiving a new bill, things like pressure of managing the expectations and the emotions of the people in our lives, feeling like we have to minimize how difficult our situation is in order to make it more comfortable for other people. So sometimes when we experience that feeling of pressure, feelings of being trapped, things like that, that might also trigger us. Specific locations can be really triggering. It might be anytime you go to your hospital. It might be the fluorescent lights of a medical office. And dates and times specifically tend to be really triggering for people. I was originally diagnosed on November 11th of 2015. And every year, even if I'm not consciously aware of the fact that it's November 11th, it's as if my body remembers and knows that this is an anniversary where a trauma took place. And so dates, times, anniversaries tend to trigger us. Now, when we experience a trauma trigger, it is the same reaction in our body that takes place whenever we're experiencing the initial trauma. I also want to make a note for our caregivers who have joined us. Caregivers, you may be experiencing trauma yourself by watching someone that you love go through this desmoid experience. But there's also something known as secondary traumatic stress that happens, and that is being exposed to somebody else's trauma on a regular basis. That also causes all of the same internal and biological reactions that we've been discussing here today. Bessel van der Kolk wrote a book called The Body Keeps the Score, which talks in depth about the experience of trauma and how it affects our brain and our body. And he says, in regards to triggers, these post-traumatic stress reactions feel incomprehensible and overwhelming. Feeling out of control, survivors of trauma often begin to fear that they are damaged to the core and beyond redemption. The reason that I am here today and that I am so excited to share with you is because I know this experience well. I know the experience of going through the diagnosis, the treatment, the having to go back to treatment and having to go back to treatment again. I know those feelings from a very personal perspective. And I have had to wrestle at times with this thought of feeling damaged to the core and beyond redemption. But the reason that we're here and the reason that we're sharing these sessions on dealing with desmoids with all of you is because that just isn't true. You are not damaged to the core. You are not beyond redemption. You have experienced something traumatic. You have experienced something that has affected not only the cognitive awareness of your experience, but has affected your whole body in a way that requires healing. And so as we continue to meet tonight and as we continue to meet together over the course of this series, we're really going to be talking about, okay, how do we get there? It's important for us to tonight lay the foundation of what is trauma and how does it affect us to be able to understand how to be able to heal from it. And today we're going to move into talking about a couple of strategies that we can use to really start developing resilience to trauma. But then as this series continues on, we're going to be diving deeper into a number of different topics to be able to combat feelings like this and understanding that our experience is challenging, our experience is hard, but that there is redemption, that there is healing, and not only that, there is actually growth and joy to be found after a desmoid diagnosis and the treatments that we go through. So this is the good part. Let's move on to healing and resilience and what does that look like? Again, we're going to talk about a few strategies tonight. There are several things, and so we're not going to be able to pack it all into tonight's session, but it's something that we're going to continue talking about over the course of this series. Now, I think it's important for us to know that trauma typically goes in phases. Now, trauma and grief and a lot of different things that we're going to be talking about, they are highly individualized experiences. And so a lot of the things that I'm sharing with you, some of them might resonate with you, some of them you may not feel like that was your experience, and that's okay. Because in reality, healing and trauma and grief and all of these things are not linear. Healing is going to feel very much like peaks and valleys, taking steps forward, taking steps backwards. It's about the process of getting to healing. And one of the things that I encourage for all of us is that it's important for us to learn how to fall in love with the process versus just looking at the final destination. And so with a desmoid diagnosis, this tends to be how trauma shows up. During diagnosis and treatment, we tend to go through what we're terming here phase 1, a period of outcry, numbness, denial, shock, being in that place of like, is this really happening to me? What can I do? Do I really have to go through this? Why me? Maybe all of those questions that have come up. During diagnosis and treatment, oftentimes we're going through a type of survival mode. We can't necessarily focus on things like grieving or focus on things like growth because we have just been in shock by the news that we've learned of our diagnosis, and we have to just muster up the strength to be able to get through the treatment process. And so in this phase, we often refer to it as survival mode, just getting through. Phase 2, we refer to as adjustment. That's that period after treatment where it's normally like, okay, how are things going to look now? This big thing, this big trauma has just happened to me. My life feels different. I wish I could go back to who I was before my diagnosis, yet I'm also looking forward to learning how I can integrate this into my life in a way that's meaningful. This period of adjustment oftentimes feels very back and forth, like we're ping-ponging between what was and what will be, and really finding a way to adjust to all of that. And then this third phase we refer to as completion and post-traumatic growth. That's learning to integrate our experience, learning to integrate our diagnosis and the trauma and the challenges and the difficult things that we've been through into our lives. And so how do we do that? We're going to touch on post-traumatic growth a little bit tonight, but it's something that we could talk about for hours. And I think post-traumatic growth is something that's really important because typically when we talk about trauma, we talk about it in terms of post-traumatic stress disorder. And post-traumatic stress and post-traumatic stress disorder are two very different things. Post-traumatic stress is a natural reaction to going through something traumatic. Now, there is not much research done on mental health and desmoids specifically. And so a lot of the research that is used is pulled on mental health and cancer. And that research shows that 90 to 95% of individuals with a cancer diagnosis experience post-traumatic stress. We'll talk at some point about the difference between post-traumatic stress and post-traumatic stress disorder. But the important thing to note for tonight is this idea of post-traumatic growth. And when we talk about post-traumatic growth, that is how do we learn to thrive after our experience with our diagnosis. And I am happy to say that research shows that it's a wide berth, but 60 to 95% of people who experience post-traumatic stress will experience post-traumatic growth. And so if you're in a phase where you're feeling extremely stressed, extremely overwhelmed, no growth, no post-traumatic growth, or no healing or resilience feels like it's in sight, it's there, it's accessible, it's a process. And so that's what we're talking about is how do we walk this process in a way to where we can ultimately get to post-traumatic growth and be encouraged and have hope, because the majority of people who experience that post-traumatic stress will experience post-traumatic growth. So for the rest of our time tonight, we're really just going to camp out in this phase 1 and different strategies for how do I develop resilience to trauma. Now, these are strategies that are not only useful for diagnosis and treatment, these are strategies that you can start using during diagnosis and treatment, but they're helpful throughout the entire desmoid journey. They're helpful through that adjustment phase, that integration phase. Maybe if we found out that we have to go back to treatment, things like that. These are helpful strategies for stress in general, trauma in general. And so we can start now, even if you were just diagnosed. So the first thing, some of these may sound really simple, but putting them into practice, they're actually quite challenging. The first thing is self-compassion, being kind to yourself. People who are self-compassionate recover better from psychological knocks. It is found that the level of post-traumatic stress that we experience is correlated highly to self-compassion, to whether or not we are down on ourselves, if we blame ourselves for our diagnosis. And sometimes I know that our minds can take us there. What did I do? What did I not do for this to happen? What did I see or not see? And so this idea of being kind to ourselves and giving ourselves permission to go through a challenging time is really important. If you're anything like me, when I was going through treatment, I did not feel well, and I spent a lot of time laying in bed and watching TV, and I remember beating myself up over and over again, like, you have all this free time, you should be doing something, you should be like pursuing this or pursuing that. And I just for a long time didn't give myself permission to just heal from the chemo that I was experiencing, or heal from the procedure that I experienced. And so self-compassion, being kind to ourselves, giving ourselves permission to go through something challenging and all of the things that come along with that, is one of the most significant things in being able to develop resilience to trauma. Journaling is something that is also very important. Whenever we talk and whenever we share our story, we are processing things through one part of our brain, but whenever we write them down, we're processing through a different part of our brain. And so the act of writing is extremely important in helping us process, like, what has just happened to me? What's going on? How am I moving forward? Journaling, oftentimes I'm an overachiever over here, and so this might not resonate with some of you, but whenever I was told to first start journaling, my thought was, if somebody finds this journal, then it has to be like a masterpiece. It has to be beautifully written so that it can be published one day and like somebody can read it. But that's not what we're talking about here. Journaling, we're not necessarily talking about keeping a record of dates either. We're talking about giving yourself, there's a strategy called therapeutic journaling, where you give yourself, you set a timer for 15 minutes and you write stream of consciousness. You write whatever is on your mind. If something that's on your mind is, I don't know what to write right now, that's what you write down. And so that stream of consciousness journaling, what that does is it allows us to be able to get all of the things that we have bottled up inside out on paper. Now, you may go back and you may read your journal and be like, this makes absolutely no sense. I don't even know what I was trying to say here. And that's okay. That is actually the point of being able to get this jumbled mess of feelings and emotions that we feel inside out on paper. And so a practice that's really, really significant is called therapeutic journaling. And it is that setting a timer for 15 minutes at a time, 4 times a week, and just writing through what you're feeling, writing through what you're thinking, writing through what your fears are, writing through what your hopes are. The next thing is a support system, and your support system is the most important factor in developing resilience. And research has shown that the most important qualities of a support system are quiet, a sense of safety, and feelings of being protected. Now, I think we've all experienced at some point the need to manage somebody else's feelings. And so needing to minimize or diminish our experience in order to make somebody else more comfortable. When we're talking about a support system, one of the most important things that we're looking at is that sense of not only physical safety, but emotional safety. The ability to speak out what we're experiencing, however raw it is, and for it to be something that is received with love and compassion, maybe not necessarily understanding, because we've gone through something that people might not understand if they haven't gone through it themselves, but with love, compassion, and appreciation for what you've shared. This fourth thing, the vagus nerve stimulation, is one of the most important things I think that we're going to be talking about tonight. Because as we talked about earlier, that vagus nerve that connects the brain to our organs in the body, it can short circuit, it can disconnect. And when it does that, it makes it nearly impossible for our body to be able to get to a place of being able to rest and achieve calm on its own. And so how do we manually override the fact that that vagus nerve has been disconnected? And what are some practices that we can implement to stimulate that nerve to help us get back to a place of resting and kind of combating and overriding that amygdala that's telling us that everything is now a threat? Now, these seem probably a little like, okay, Ashley, are these really going to work? But they're actually extremely significant when we're talking about trauma, since trauma is something that affects the entire body. And I think it's important to remember that these things are practices. And so you'll see the first one is gargling. It's not that we're going to gargle one time and we're going to immediately feel better. But over time, if we're able to incorporate some of these exercises that stimulate the vagus nerve, it's reteaching our body how to calm down in the midst of chaos. And so here are some ways that we can do that. Gargling may seem funny, but when we gargle, it actually stimulates the back of our throat, which is where the vagus nerve runs through. And so it's actually something that's physically touching the vagus nerve to stimulate it. Same with singing or chanting. Chanting, I might sound strange, but when we talk about yoga practices and we talk about the Om portion of practices and chanting that's actually stimulating our vagus nerve to be able to bring that calm back to our body. Singing is an important strategy, and singing loudly. The louder you sing, the better in regards to vagus nerve stimulation. Laughter, yoga. I know there's often jokes that go around how people's number one thing that they tell us once we receive some sort of diagnosis is like, you should do yoga, and I kind of agree with that, not from a perspective of getting exercise necessarily, but yoga is a really powerful practice in being able to help us stimulate that vagus nerve through stretching and through breathing. Breathing is probably the number one way to be able to stimulate that. It's essentially us manually regulating our body, regulating our nervous system. And so that box breathing that we talked about before, incorporating that in a couple of times a day will be really significant. Movement of any kind, being in nature, dancing, being creative, all of these things will stimulate that vagus nerve. This mindful play, no agenda, non-doing time. The idea of being overwhelmed is whenever we are just overcome with so much emotion that we just don't even know which way is up. We are experiencing too much stress. And research has shown us that the antidote for overwhelm is mindful play or no agenda, non-doing time. And essentially what that means is do something that doesn't have to be done. Do something for enjoyment. If that is doing a craft, great. If that's watching a TV show, great. When I'm overwhelmed, I have a game on my phone that I play. I never play games on my phone, but I find myself gravitating towards this specific game on my phone when I'm overwhelmed because it's no agenda, it's play for me. And so really capitalizing and understanding when we say play and no agenda time, really trying to incorporate that in a very real way into our lives on a regular basis can help combat overwhelm. Progressive muscle relaxation is a way of helping our muscles relax. So again, whenever we're in that fight, flight, or freeze mode, our muscles tend to tense up. And when the vagus nerve is disconnected, the message is not sent, okay, that your muscles need to relax, like it's time for them to relax now. So progressive muscle relaxation is a technique that we can use to actually tell our muscles like, okay, even though we might feel stressed, it's time for our muscles to relax. And so if you go online, you can find progressive muscle relaxation exercises that they walk you through, but it's essentially going through each muscle group in your body, squeezing it tight and releasing with the intention of trying to relax it fully. Storytelling is something that is extremely significant in regards to trauma. Trauma begs to be told. And so storytelling is going to be a really important piece in recovering and developing resilience to trauma. When we are in that fight, flight, or freeze mode, certain parts of our brain shut down so that the amygdala can take over. And the parts of the brain that shut down are considered like non-essentials for survival. And one of the parts of the brain that shuts down is the storytelling part of our brain. And so telling a story of trauma that we've experienced sometimes can be really, really challenging because we might not fully remember what we've been through. We might have a spotty memory. It might be really choppy, but it doesn't matter. We don't have to remember the totality or the entirety of what we've been through. Just the practice of sharing our story with someone who's safe and someone who's protective, like a loved one, maybe a therapist, is going to be really important. And the final thing that we're going to go over today is theater. I know that we have some theater buffs as a part of the Desmoid community, and theater can be really powerful in being able to help us build resilience to trauma. And one of the reasons is because when we are in theater and we're playing a role, we have the opportunity to feel really deeply, approach conflict, connect to our body, and connect with others as somebody else. And so the feelings and the emotions that come up are still authentically being played out, but they feel a bit less threatening because they are not necessarily our emotions that we're communicating. So these 8 strategies are strategies that we can start using now. We can start using upon diagnosis, and we can use them throughout our Desmoid journey. Like I said, they might feel simple, but they're really powerful because the number one goal in developing resilience to trauma is calming our nervous system first. Since it's that whole body experience, and since it's characterized by our nervous system kind of going haywire, the manual override of trying to get our nervous system to calm down is the most important thing for us to remember. Now, we're going to skip over a couple of things just for the sake of time tonight, but I know I talked about the 2 other phases of trauma, the adjustment phase and then the integration phase. And the adjustment phase, I just want to note, it's characterized by grieving. Once our nervous system calms down, that's when grief really tends to come in. And as a Desmoid patient, there's a lot of things to grieve. We go through a lot of loss, not just of our health, but there are so many collateral losses that come along with our experience. And so when we're walking through a grieving process, I think one of the most important things for us to remember is that it's not linear. Oftentimes we feel like we're going back and forth between being okay and being really feeling the depths of our loss. And then we feel okay again. And then we're really feeling the depths of our loss. And that ping pong back and forth is really what the grief experience is like. And so some of you may be in that period. And then that integration phase is really talking about post-traumatic growth. And so in future sessions, we'll be touching on what does grief look like, how do we grieve, and how do we overcome grief. And then we'll also be talking about post-traumatic growth and what does that look like and how do we achieve that. But today, I think one of the most important goals for us as we start this conversation together and as we start this series together is to really be talking about, okay, what is trauma? How does it affect our bodies so that we can understand how do we develop resilience from that and ultimately heal from that? And this is a very good, necessary starting point of being able to employ some of these strategies to help calm our nervous system, because our nervous system has to be calmed first before we're able to walk the path to any other towards any other type of healing. So Lynn, I'm going to throw it over to you. I know we have the question and answers open. And so if you have any questions, feel free to type them in the chat. And we have a little bit of time now to go through any questions that you might have.
Okay, wonderful. So I do have a few questions for you, Ashley.
Okay.
Could you go a little bit deeper into describing how to get to post-traumatic growth?
Yeah. Let me, I will advance some of the slides because that's something that we are going to talk about in one of our upcoming sessions. But with talking about post-traumatic growth, again, I think it's so important to note that we all have probably experienced post-traumatic stress, and that post-traumatic growth is something that 60 to 95% of us get to when we experience post-traumatic stress. Now, I think I also shared that one of the most important things to note is that you cannot achieve post-traumatic growth without experiencing stress after trauma. And so we tend to look at people who feel or seem unaffected by our diagnosis as like, oh, they're the resilient ones, like they're unaffected. They're not hurting. Their side effects don't seem to be as bad. They don't seem to be struggling as much as I am. But in reality, resilience is built out of the adversity that we go through. And so for us to experience stress after trauma, that's what actually unlocks the ability for us to experience growth. And growth, whenever I talk about it, I'm talking about these 5 different realms that are on the screen. There's lots of growth that happens, but we tend to see them in these categories. And this might resonate with some people. But our ability to relate with other people, so that's developing empathy for others, but also learning how to receive from others, being open to new possibilities, reprioritizing. I hear a lot from people that, you know, I have different priorities than I had before my diagnosis. Personal strength, feeling empowered, feeling like, man, I have been through some really tough and really challenging things, and I can get through a lot more than I thought I could. Appreciation of life, being able to just recognize the beauty in things, and then also this piece of developing spiritual depth or having more interest in the spiritual side of things. These tend to be where we see post-traumatic growth happening, and there's a process that we can take to get there, and I'll just briefly give a few pieces of it, but it starts with how do we learn to calm our nervous system and getting our nervous system to that place of equilibrium and that place of balance before we're able to move through some of the other phases. And some of the other phases are, when I feel hopeless, how do I find hope? Because hope is out there, but oftentimes I might feel hopeless with the diagnosis that I've received or with the treatment options that I've received. How do I cultivate gratitude, being grateful for the things that have happened because of my diagnosis, experiences that I've had that I may not have had if I didn't receive a desmoid diagnosis. And then how do I move forward with that gratitude and really making meaning of the experience that I've been through? So I know that sounds a little bit vague, but it's something that we're going to be going through in depth at some point in our series.
Great. So I have another question here. What type of therapist or therapy do you recommend for those experiencing prolonged trauma or never-ending trauma?
It's a great question. I have a couple of resources on the screen. A lot of the information from this session in particular are found in these 2 books. This one, The Body Keeps the Score. It's a pretty dense academic book. It takes a while to read, but in the second half of the book, it talks about a number of therapeutic modalities or therapeutic approaches for dealing with trauma. And so the main thing that you would want to look for in a therapist is a therapist who has an awareness of trauma or maybe has an awareness of medical trauma in particular. Because in regards to our desmoid diagnosis, that's what a lot of us have been through. Now, this book discusses different techniques like EMDR, internal family systems, some things that are important to look into to see if those types of treatments resonate with you. But the main thing that I would be concerned about or that I would recommend is looking for a therapist who has experience in trauma and who has experience preferably in medical trauma. Yes, so I hope that answers your question.
Okay, next up, we have an attendee who says they have a very bad memory. They ask, is this a result of trauma I don't want to remember?
Yeah, it's difficult to say. Could it be? Yes. Could it not be? Also, yes. Depending on the types of treatments that we've been through, medically, there might be an effect on our memory, but trauma does definitely impact our memory. I can't say that for sure without knowing your individual case, but as I mentioned before in the storytelling piece, when we're in that fight, flight, or freeze center of our brain, different parts of our brain shut down in order to allow for us to go into survival mode. And so one of those parts of our brain that shuts down is telling stories or housing memories. And so again, oftentimes our memory can be really spotty. Right before my diagnosis, I was in a pretty bad car accident, and there are some things I remember about the car accident that were extremely vivid, and there are a lot of things that I don't remember. And often I get the response of, how could you not remember that? It was so like impactful and so dramatic. But our brain does have a protective mechanism sometimes of shutting off those memories or shutting off those things because we don't necessarily want to remember them. But I do think it's important to note that even if our minds don't remember something, oftentimes our body remembers something. And so those trauma triggers may be alerting us to memories that are stored in our body that aren't necessarily stored in our brain. So it's important to take those into account.
Okay, we have another. We have an attendee who says they're a bit overwhelmed. They feel like they've been traumatized multiple times since their diagnosis. Is that possible? And if so, how do I come back from that?
Yeah. I think our experience is full of different traumas throughout its timeline. And so, yes, that is definitely very possible to feel like we've experienced trauma multiple times throughout this journey. Most likely we all probably have. But I think the most important thing to remember, and hopefully is encouraging, is that we don't necessarily have to go back and revisit each trauma event, because trauma is more about how we experience it and what happens inside of us versus what happens to us. And so executing some of these strategies for calming our nervous system is really going to be the first step in combating the trauma that we've experienced in a holistic way, and in a way that no matter how many traumas we've experienced or how many times we feel like we've been traumatized, to try to facilitate that reconnection between our brain and our body, to try to stimulate that vagus nerve and bring our nervous system to a place of calm, is ultimately going to help us heal from however many traumas we've experienced.
That's great. Okay. We have another question. This attendee says they're not sure if they have trauma, but chronic pain is definitely affecting their mental state. Any advice or recommendations?
So for pain, I'm always going to have to direct you back to your doctor, because there are so many different root causes of pain. But again, I think some of these strategies that we went over for calming the nervous system can be very powerful in helping with chronic pain potentially as well, because it is an anti-inflammatory response for our body as well, to try to calm our nervous system down. And so those strategies are things that I would recommend trying. I would check with your doctor first and make sure that there are things that are okay with whatever your treatment plan is.
Okay, great. Another attendee asks, is guilt a part of the trauma process? I feel such guilt for the effects of my diagnosis on my daughter and husband.
Mm-hmm. For whoever asked this question, I am so glad that you asked. I'm sorry that that's your experience. I know that guilt is such a difficult emotion to work through and to live with, but 100% guilt is part of the trauma that we experience. Oftentimes, one of the things that holds us back from post-traumatic growth actually can be guilt. That's something that the research shows us, because if what we tend to do is we tend to first, within our own community, we tend to compare our situation with other people, and that often leads to feelings of survivor's guilt. And survivor's guilt means a number of different things, and we'll talk about that later in our series together too. But guilt affects the way that we relate to other people with our diagnosis, because we tend to compare ourselves to other people and whether or not we deem our experience more significant or less significant than their experience, but also with our caregivers and our loved ones, 100%. I think we see that this diagnosis can be really taxing. And so it's taxing not only on us, but it affects the energy and the well-being of the people that we love as well. And so guilt plays in a number of ways, and makes the process to healing a little bit more challenging, but there are strategies that we're going to be talking about in future sessions in regards to guilt and how it shows up in our experience and how we can work through those things. And so you're picking up on something, a tie that's very important, that they tend to show up at the same time. Whenever we've experienced a trauma, there tends to be guilt attached to it too. And so grieving in regards to guilt, those are closely tied. That's something that we'll be talking about.
Okay, we have another question. Is denial or avoidance of a desmoid diagnosis ever an appropriate response?
Ugh, this is a great question. Yes and no. And so with denial and avoidance, especially when we're in that survival mode phase. And so typically, again, we tend to refer to survival mode during diagnosis and treatment, but it can extend far past that, or it can show up at later points in our journey too. But whenever we are just so overwhelmed by the things that are happening in our life, to avoid or to distract ourselves for a little bit is a perfectly acceptable coping strategy. However, I did mention before that the difference between post-traumatic stress and post-traumatic stress disorder, I know I said I would talk about it later, but the difference between those two is actually avoidance. And so if we continue to avoid the feelings that are going on inside of us and those internal sensations, that's whenever post-traumatic stress can develop into something that becomes far more challenging for us to experience. And so can it be used whenever we're highly overwhelmed and we just need to take a break from it? Yes, but we don't want to avoid forever. And so again, that's where some of these strategies for calming the nervous system come into play and are extremely significant, because while our nervous system is heightened, we might be too overwhelmed to deal with a lot of the sensations that are going on in our body or a lot of the things that we're being confronted with. But if we can try to get our nervous system to a place of calm, then that gets us to a place where we can actually confront those things individually and no longer avoid them as a coping strategy, but employ other coping strategies. But our nervous system getting calm is the first step in that. So hopefully that answers your question.
Okay, great. One other question we have, it looks like, this attendee says they feel like they're being triggered all the time. How do I figure out what triggers me?
That's a really good question too, because triggers often come up without us being aware of them. And so we've all probably been through situations or times where we're like, why am I acting this way? Or why am I reacting this way? Like, this feels out of place for what's happening in my world right now. For me, like, I'm at Christmas dinner with my family and everybody's happy and I smell cleaning, I smell rubbing alcohol, and immediately I'm transported somewhere else. And it's like, I just feel the heaviness, and that triggered for me things that I had been through before. I think one of the most important things is first, bring awareness to those times that you're thinking like, what is going on? Like, what am I feeling right now? Why am I acting this way? What's happening? I feel a little bit out of sorts. And as I mentioned before, I am a big fan of journaling. And so being able to take 15 minutes, set a timer, write through What happened that made me feel this way? Ultimately, the goal is to try to narrow down and identify what are those things that trigger me. Because if I can identify what they are, then I can either avoid triggers, which is okay to do, or if I'm triggered by something, then I am able to identify what it was and walk through a process of rationally calming myself down, reminding myself that I'm actually in a safe place, that I'm not threatened, and I'm not in the same place that I was whenever that initial trauma took place. But one of the most important things is going to be, how do I identify my triggers? And journaling is a really valuable process for being able to do that or start doing that.
Okay. I think we just have one more.
Okay.
This attendee says, do you think that trauma treatment can be addressed with our teams following surgeries or treatments as part of a protocol?
I think that would be ideal. But I know that mental health with a diagnosis in many facilities is not addressed. And so being able to bring it up with your treatment team, I think is really valuable. However, I can't say what their reaction is going to be, because the large body of research having to do with trauma is typically in regards to abuse survivors, natural disaster survivors, and soldiers who are coming home from war. And there's a small body of research that talks about how cancer specifically is a traumatic experience. There's more and more research that's coming out that supports that cancer and chronic illness, rare disease, a diagnosis and treatment is traumatic. And there is one research study out there actually that talks specifically about the mental health experience for Desmoid patients. And I wrote down what it said because I didn't want to forget, but it says that Desmoid patients have a high prevalence of persistent emotional distress compared to patients with malignant sarcoma. So when we're talking about Desmoid patients in regards to this body of research having to do with cancer patients, what that's saying is it's likely that a Desmoid patient's experience is consistent, if not more enhanced, than someone who has a cancer diagnosis, just because of the prolonged experience that many of us go through. And so would that be ideal? Yes. If your treatment team does not have a mental health professional, if they don't have a psychologist, I would recommend finding one for yourself to walk through this process with you. And to seek out that support, even if it's something that your treatment team doesn't provide or doesn't offer. If they do, it's something that I would definitely recommend taking part in.
Okay, and I think we have just one more. Keep going. So one attendee says, with Desmoids, because of the possibility of having multiple treatments, it feels like some of the stages are prolonged or restart all over again. Can you address this?
Yeah, I think that you're right on. I think you're picking up on the fact that a Desmoid patient's experience is very different than these categories that we tend to structure learning about trauma in. So yes, you are correct. We can go back and forth between these stages. This is not a linear process. If we have gone through diagnosis and treatment, and then we have a period of kind of adjusting, but then we find out that we have to go back to treatment later, or we're in a watch and wait phase and we're every 3 months getting scans done, all of those things are triggers to the medical trauma that we've been through. And so even though trauma and the things that we go through are a highly individualized experience, the experience that goes on within our bodies is essentially the same. And so going back to some of those strategies of calming our nervous system, regardless of how many traumas we've experienced, regardless of how prolonged those individual states may be for us or what order they're in, the number one goal when we've experienced traumatic stress like we have is to calm our nervous system first. Because once we calm our nervous system, that creates a springboard for us to be able to pursue healing in a number of different ways that we're going to continue talking about. But that is the first step for anybody who's experienced trauma.
Okay. I think that's all the questions that we have. Ashley, do you have anything else for us before we wrap up?
I don't. I do. Well, I guess let me share what's on the screen. I do have a couple of resources available. And so, like I mentioned, the one book, The Body Keeps the Score, if you're interested in learning a bit more, goes in depth about our experience from a body perspective whenever we experience trauma. The book, What Doesn't Kill Us, talks specifically about post-traumatic growth. And so even though we'll talk about it in a future session, if you just can't wait and you want to learn more, this book really talks about how do we start that process and how do we move along that process of getting to the place of growing after the things that we've experienced. And finally, if you feel very overwhelmed or you feel impulses or urges to either harm yourself or have suicidal thoughts, I have some resources for you on the screen as well. Many of the resources are for those who are in the US. If you're joining us from a different location, then befrienders.org is listed there as well to help provide any contact information for any emergency hotlines in your area. And so these are some immediate resources to be able to look at, and also ones that will direct a lot of the conversations that we'll have upcoming in this series.
Excellent, excellent. Ashley, thank you so much for joining us for today and for addressing this important topic of trauma resilience. We also thank the Desmoid patient and care partner community for joining us as well. Please note that we will be sharing a recording of this webinar after it's edited. It's probably going to take a couple of weeks for us to do that, but we will definitely make sure that, that you receive it. In order to make sure that you do, please go to dtrf.org and subscribe to our mailing list. Also stay tuned because, as Ashley mentioned, we will be hosting additional Dealing for Desmoids webinars. The next one will be in roughly 2 months. So stay tuned for that. Ashley will cover another topic about coping strategies for patients. We hope to see you at future webinars, and we thank you so much for joining us. Thanks again, Ashley, and we hope everyone has a great night. Bye-bye.